Pinched nerve symptoms, locations and treatments. A pinched nerve is a common source of pain among the elderly, people who perform a lot of repetitive movements, those with arthritis and anyone struggling with obesity. Although they sometimes heal on their own, pinched nerves can cause significant disability and sometimes even permanent nerve damage when left untreated. Determining how many people actually have pinched nerves is very difficult, since many people report symptoms that could be caused by another injury, and some people don't experience any symptoms at all. Many different factors can contribute to a pinched nerve, including past injuries, someone's level of exercise, age, gender and body weight. While there isn't just one single cause of pinched nerves, prevention seems to be very important. Conventional methods of treating pinched nerves usually include medications and surgery. However, research shows that non-surgical, more conservative treatments, including physical therapy, exercise, chiropractic adjustments, supplements and rest, can also greatly help reduce pinched nerve pain. What is a pinched nerve? Pinched nerves, also called compressed nerves, are deep root nerves that have become inflamed and irritated due to experiencing an abnormal amount of pressure. Pressure can accumulate around a deep root nerve from surrounding tissues, bones, cartilage, muscles or tendons that protrude outward or are damaged due to an injury or inflammatory condition. Nerves are responsible for sending important sensory information regarding pain, well-being and perceived threats from our bodies to our brains, and vice versa. Major nerves travel from your brain through your spinal cord and down the center of your back, connecting to small series of nerves that stem off into your limbs and elsewhere. A pinched nerve causes painful sensations in addition to things like pins or needles and swelling because increased pressure changes the way nerves communicate. What are some common conditions that might cause a pinched nerve? These can include a herniated disc in the lower back or a pinch near the neck. One of the most troubling things about pinched nerves is that they usually don't just cause pain in one location. The pain often spreads, for example, extending down the legs, to the hands and into the shoulders. Causes of a pinched nerve: compression, increased pressure and stress, placed on a root nerve is the primary cause of a pinched nerve, which interferes with normal signals regarding pain. There are several locations in the body where pinched nerves are common and numerous reasons that someone might develop a pinched nerve. The causes of a pinched nerve can include: 2. Herniated disc, caused from a disc tearing or weakening. Wear and tear associated with aging and inflammation. Poor posture, such as forward head posture. Obesity. Repetitive movements that wear down or irritate tissue. Staying in one position for long periods of time, such as those related to someone's job or hobbies. Injuries, such as trauma, tears and sprains. Bone spurs, which narrow the spaces where nerves travel. Recovering from conditions or treatments that cause neuropathy, including breast cancer and diabetes. 3. Arthritis and degenerative joint diseases. What makes a pinched nerve different than a herniated disc or slipped disc? For the most part, people use the terms herniated disc, bulging disc, slipped disc, and pinched or compressed nerve interchangeably. 4. It can be hard to tell if a pinched nerve versus a herniated disc is the exact cause of your pain, numbness or tingling, but the good news is that both types of conditions are usually treated in similar ways. Although they're closely related, herniated discs are not exactly the same as pinched nerves. Herniated discs and slipped discs can contribute to pinched nerves because they cause tissue to protrude into a nearby nerve. Usually they're the result of aging, degeneration, injuries or various diseases that affect the nerves in the spine. These conditions cause spinal discs to open and expand, which can lead to fluid leaking out, worsened inflammation and increased pressure. That being said, it's important to understand the real causes of your pain in order to know how best to treat it. Because there are various reasons you might have disc or nerve pain, it's important to work with your doctor to identify if pain is at the site of the disc location itself or if it's coming from a nearby irritated pinched nerve. Prior to taking medications or receiving adjustments, and definitely before undergoing surgery, getting an accurate diagnosis is crucial. Pinched nerve symptoms. What does a pinched nerve feel like? Pain, nerve damage and irritation caused by a pinched nerve can sometimes be minor but other times severe. It's possible for symptoms of a pinched nerve, such as tingling or shooting pains, to come and go temporarily or to become chronic problems. Pain can occur in the cervical, neck, region, thoracic, upper, region or lumbar, lower, spine. While in some cases pinched nerve pain goes away relatively quickly, in other rare cases that are left untreated, it can lead to permanent nerve damage and chronic pain. Although the location of a pinched nerve determines the types of symptoms you feel, most pinched nerves have the following in common: tenderness and pain, swelling, feelings of extra pressure, and some degree of scarring. Increased pain when moving and trouble exercising are also common pinched nerve symptoms. Pinched nerve symptoms aren't usually located to one area, rather they cause radicular pain, nerve root pain, that tends to spread from one body part to another. The word radiculopathy refers to a variety of symptoms, including traveling pain, numbness and weakness. 4 symptoms of a pinched nerve in your neck or shoulder include 5 pain, numbness and tingling that radiates from your neck down your upper back, shoulders or arms. Symptoms might affect your elbow, hand, wrist or fingers. It's common for pain to get worse when you move, type on a computer or lift things. You might experience pins or needles, inflammation, weakness, and pain associated with conditions like carpal tunnel syndrome, golfer's elbow or tennis elbow. Your grip may become weak, and your arm or hand might become stiff. Symptoms of a pinched nerve in your back include 6 back pain radiating from your lower back running down your legs. Pinched nerves are most common in the lower back because the lower back bears a high percentage of pressure and force. Burning sensations, tingling, heat and weakness might be felt in the thighs, low back or buttocks. Sometimes the pain might spread upward to your chest and neck. Pain likely gets worse if you exercise, after waking up from sleeping, or when you're bending and walking. Conventional treatments for pinched nerves. To help make a diagnosis of a pinched nerve, your doctor will likely perform a physical exam, testing reflexes, tenderness and pain. Assessment of your medical history, family history and injuries. Tests for muscle strength or weakness, testing for signs of muscle atrophy, twitching, numbness. Testing pain based on motion, touch and pressure. Testing joint dysfunction through moving your limbs and torso. Diagnostic tests, including quartz scan or magnetic resonance imaging, MRI, to look at disc alignment and configuration. Once the location of your pain has been identified and a pinched nerve is diagnosed, conventional treatments might include 7 pain relievers, non-steroidal anti-inflammatory drugs, NSAIDs, are the most commonly used medications. These include aspirin, ibuprofen or naproxen. Sometimes doctors even prescribe strong narcotics for chronic nerve pain. They can help dull inflammation and pain, but long-term they won't solve the pinched nerve and can cause side effects when used for long durations, like indigestion, for example. Corticosteroids, used to lower swelling. Microdiscectomy spinal surgery, this removes part of the disc that's bulging out or other material that's irritating a root nerve. It's a risky type of spine surgery that's usually only effective for treating degenerative disc diseases, however, it doesn't always address the real cause of pain associated with a pinched nerve. Surgery to remove other material that's pressing on a nerve, such as scar tissue or bone. Natural treatments for pinched nerves. 1. Follow a collagen repair diet. Consume a diet high in natural sources of collagen, which helps repair damaged connective tissue and adds cushion to spaces between bones and joints, reducing friction and pressure. Collagen is the most abundant natural protein found within our bodies and an important building block of all tissue. Bone broth is one of the best suppliers of collagen, along with other beneficial nutrients, including glucosamine, chondroitin, hyaluronic acid and amino acids. Eating omega-3 foods, such as wild-caught fish like salmon, grass-fed beef, chia seeds and flax seeds, helps naturally control inflammation and reduce the effects of aging. Get even more antioxidants and anti-inflammatory compounds through organic vegetables, organic fruits and herbs like turmeric, garlic and ginger. These anti-inflammatory foods help slow the effects of aging by reducing oxidative stress and supply essential vitamins and minerals to help you recover. High-fiber foods can also help control your appetite, and many supply important vitamins, antioxidants and minerals. Obesity and excess weight can add pressure to nerves and make pain worse, so try limiting added sugar, sweetened drinks, fried or packaged foods, and refined carbohydrates. For a specific cookbook with meal plans that supports collagen repair, check out my Bone Broth Breakthrough. 2.